A 58-year-old man is brought to the emergency department because of confusion, weight loss, and anuria. He has chronic kidney disease, hypertension, and type 2 diabetes mellitus. He was diagnosed with acute lymphoblastic leukemia or ALL at the age of 8 years and was treated with an allogenic stem cell transplantation. He is HIV positive and has active Hep C virus infection. He drinks around 8 cans of beer every week. His current medications include tenofovir, emtricitabine, atazanavir, declastavir, so fosbuvir, so all of the viral medications, insulin, amlodipine, and enalapril. He appears lethargic. Temperature 36, pulse 130, respirations 26, and blood pressure 145 over 90. Examination shows severe edema in his legs and generalized muscular weakness. Auscultation of the lungs shows crepitant rales. Lab study shows positive HCV antibody and positive HCV RMA. Viral load, HIV viral load is undetectable and CD4 count is 589. 6 months ago it was 618. ECG for the heart is it shows arrhythmia with frequent premature ventricular contractions, and you have ABG numbers over here, which is pH, PCO2, bicarb, and base axis. Patient states he would like to donate organs or tissues in case of his death. Which of the following is an absolute contraindication for organ donation in this patient? Your options: hypertension, Hep C infection, HIV infection, childhood leukemia, acute kidney injury, alcoholism, and no absolute contraindication. So here we have a really huge question with a very simple answer. So here they gave a very complicated scenario and they asked, what will be the absolute contraindication for organ donation in this patient. So if you look at this patient has a lot going on, right? He has confusion, weight loss, anuria. So that's 7.23, which is very, very low. It's acidosis that is causing the confusion. Patient is anuric, right? Chronic kidney disease, type 2 diabetes. Diabetes, chronic kidney disease together can also cause it. All right, he was diagnosed with ALL at the 8 years old and then he got a transplant. So this line over here, you can definitely eliminate it because he has already got the treatment, right? Moving forward. He is HIV positive and Hep C positive, fine, but he is also drinking every week and he has been taking all his medication. Appears lethargic, same reason. Temperature, pulse is a little high, temperature is okay, and he's a little hypertensive and tachypneic. So tachycardia, tachypnea, hypertension. Severe edema in the legs and generalized muscular weakness. Okay, his lungs have crepitant rales. He has positive HCV antibody and even its RNA. HIV load is indetectable and CD4 count is high. Saying that CD4 count is high and his HIV viral load is undetectable, you can again rule out HIV infection. Why? We will gonna go over the options again. ECG has arrhythmia with frequent premature ventricular contractions, right? Because he's acidotic. It is metabolic acidosis with respiratory compensation because he's tachypneic, right? So what is the absolute contraindication for organ donation? Hypertension. Can hypertension be a contraindication? No. Right? Why? Because it itself is not causing any particular damage unless it actually leads to a heart failure in somebody who has a low ventricular ejection fraction, then it could be a contraindication, otherwise no. Let's go with the answer first. So the answer is actually no absolute contraindication. Okay, this patient has a lot going on, but he can still donate and he can still donate his organs and tissues in case of his death. Why? Let's go over the rest of the options because the rest of it what this patient actually has. So we talked about hypertension, right? In itself is not, but if it leads to left ventricular ejection fraction being less than 50%, then that is a contraindication. Okay, hepatitis C infection. As long as you are donating organ from a Hep C donor to a Hep C recipient, it is not a contraindication. Make sense? This patient has blood virus detected. Again, it is not a contraindication. As long as he is actually donating to somebody who already has hepatitis C. Okay? HIV infection. So again, same goes for hepatitis C. I mean, it's the same thing. As long as he's donating to an HIV positive recipient, he is not, I mean, HIV is not a contraindication. But to donate it from a donor to recipient in an HIV positive person, there has to be no detectable viral load, and CD4 count has to be more than 500, and even 6 months ago, for more than 6 months, it has to be more than 500. Okay. Childhood leukemia. So childhood leukemia in itself is not going to cause any damage, because in this patient it was treated already, right? Moreover, even if it's a low grade tumor and it's a localized tumor, is also not a contraindication. But if it is an incurable and a metastatic disease, then it is a contraindication. Okay. Acute kidney injury. AKI in itself is not a contraindication again. Okay. Alcoholism. Alcohol can damage your liver and pancreas. So people with alcoholism cannot donate liver and pancreas, but they can donate other solid organs. Diabetes is also a contraindication for pancreatic donation. Okay, so that explains rest of the answers, and the answer is no absolute contraindications. So what are the contraindications? First of all, for organ donation, right? As I mentioned, incurable or metastatic disease, right? Sepsis, people who have infection all over the body. Of course, they are not gonna, donate anything, because most likely they are going to transmit that infection. Transmissible spongiform disease, what we call Creutzfeldt-Jakob disease, contraindicated. Cardiac arrest that occurred before brain death, that is also contraindication. Okay, because it's gonna lead to organ failure. Does that make sense? If it's a cardiac arrest, your heart kind of stops. And so no blood supply leads to organ failure. If the organ is already failed, then you cannot donate. Depends on the timeline as well. How long did it take? Okay. So in this answer, it's a no absolute contraindication.
Thanks for watching. Please give a thumbs up and subscribe for more.